Every year, on September 28th, we observe World Rabies Day, a crucial initiative to raise global awareness about rabies, a deadly yet preventable viral disease. This day highlights the devastating impact of rabies, especially in developing countries, and promotes vaccination campaigns and responsible pet ownership. It unites governments, organizations, and individuals in the fight against rabies. By commemorating this day, we reaffirm our commitment to protecting human and animal health. Together, we can achieve a rabies-free future. Rabies is a zoonotic disease, meaning it can be transmitted from animals to humans. It's caused by a virus that attacks the central nervous system, leading to severe neurological symptoms. The virus primarily affects mammals, with dogs being the most common source of human rabies infections globally. Understanding the nature of this virus is crucial for effective prevention and control. The rabies virus belongs to the genus, a group of RNA viruses known for their neurotropic nature. The virus travels through the nerves from the site of the bite to the brain, where it replicates and causes severe neurological dysfunction. Once the rabies virus reaches the brain, it causes a cascade of devastating effects. It disrupts the normal functioning of the brain, leading to symptoms such as confusion, agitation, hallucinations, and seizures. Without prompt treatment, rabies is almost always fatal. Vaccination is highly effective in preventing rabies in both humans and animals. Early symptoms of rabies can be subtle and often mimic those of other illnesses, making diagnosis challenging. These initial symptoms may include fever, headache, muscle aches, and fatigue. As the disease progresses, more specific neurological symptoms emerge, signaling a critical stage of the infection. Recognizing these symptoms is crucial for seeking timely medical attention. One of the hallmark symptoms of rabies is hydrophobia, or fear of water. This develops due to painful spasms in the throat muscles when attempting to swallow. Other neurological symptoms include agitation, anxiety, insomnia, and hallucinations. In some cases, rabies can present in a paralytic form, also known as dumb rabies. The incubation period for rabies can vary significantly, ranging from a few weeks to several months. Prompt diagnosis and treatment are essential for survival. Rabies is primarily transmitted through the saliva of infected animals, most commonly through bites. The virus can also enter through scratches, open wounds, or mucous membranes. Dogs are the main source, but bats, raccoons, skunks, and foxes can also carry the virus. The rabies virus is inactivated by disinfectants like soap, bleach, and alcohol. Preventing rabies involves vaccinating pets, educating communities, and controlling stray animals. Section 5. Diagnosing rabies, confirming the threat. Diagnosing rabies in humans can be challenging due to the variability of symptoms and the lack of a single definitive test. Doctors typically rely on a combination of factors, including the patient's medical history, clinical presentation, and laboratory tests, to reach a diagnosis. Laboratory tests play a vital role in confirming a rabies diagnosis. These tests may include testing saliva, serum, cerebrospinal fluid, and skin biopsies for the presence of the rabies virus or its antibodies. Direct fluorescent antibody, or DFA, testing of brain tissue collected post-mortem, is considered the gold standard for rabies diagnosis. Several newer diagnostic techniques are being developed and evaluated for rabies, including polymerase chain reaction, or PCR, assays and advanced imaging techniques. Early diagnosis of rabies is essential for effective treatment. Therefore, prevention through vaccination remains the most effective strategy for protecting against this deadly disease. Section 6. Prevention is key. Vaccination and public awareness. Vaccination is the cornerstone of rabies prevention. Safe and effective rabies vaccines are available for both humans and animals. Pre-exposure prophylaxis, or PrEP, is recommended for individuals at high risk of exposure to rabies, such as veterinarians, animal handlers, and laboratory workers. Post-exposure prophylaxis, or PP, is administered to individuals after a potential rabies exposure. Public awareness campaigns play a vital role in educating communities about rabies prevention and control. These campaigns aim to dispel misconceptions about rabies, promote responsible pet ownership, and encourage individuals to seek medical attention after any potential exposure. Promoting responsible pet ownership is essential for preventing the spread of rabies. Community-based rabies control programs are crucial for implementing effective prevention strategies. Collaborative efforts between governments, organizations, and communities are essential for achieving rabies elimination goals. Section 7. Treatment options. A race against time. Unfortunately, there is no effective treatment for rabies once clinical symptoms appear. The disease is almost always fatal at this stage. However, prompt administration of post-exposure prophylaxis, or PEEP, after a potential rabies exposure can prevent the virus from reaching the brain and causing disease. PEEP consists of a series of rabies vaccine injections and, in some cases, rabies immunoglobulin. The regimen and dosage depend on the nature and severity of the exposure. Timely administration of PEP is crucial for its effectiveness. While PEP is highly effective in preventing rabies after exposure, it's not a substitute for pre-exposure prophylaxis, or PrEP, for individuals at high risk. Research into new treatments for rabies is ongoing. Section 8. Global impact and control efforts. A collaborative approach. Rabies remains a significant public health concern in many parts of the world, particularly in developing countries where access to rabies vaccination and PEP is limited. The disease disproportionately affects rural communities and children. Global collaboration is essential for addressing this inequity and achieving rabies elimination goals. The World Health Organization, the World Organization for Animal Health, and the Global Alliance for Rabies Control are leading the global fight against rabies. These organizations work together to promote rabies control strategies, support national rabies programs, and advocate for increased investment in rabies elimination efforts. Several countries have made significant progress towards eliminating rabies through comprehensive control programs. The global goal is to eliminate dog-mediated human rabies by 2030. Achieving this ambitious goal requires a concerted and collaborative effort from governments, organizations, and communities worldwide. Section 9. The role of communities. Education and responsible pet ownership. Communities play a vital role in rabies prevention and control. Educating community members about rabies transmission, prevention, and the importance of seeking medical attention after potential exposure is crucial for empowering them to protect themselves and their families. Responsible pet ownership is a cornerstone of community-based rabies control. This includes ensuring pets are vaccinated against rabies, keeping them under supervision, and preventing them from roaming freely. Promoting spaying or neutering of pets can also help control stray animal populations. Community-based rabies surveillance programs can help track the spread of rabies and identify high-risk areas. Community participation is essential for the success of these programs. Section 10. A call to action. Eliminating rabies together. World Rabies Day serves as a powerful call to action for individuals, communities, and governments to unite in the fight against this preventable disease. We each have a role to play in eliminating rabies and protecting future generations from its devastating impact. Supporting rabies vaccination programs, both for humans and animals, is a crucial step towards achieving a rabies-free world. Donating to organizations that provide rabies vaccines and support rabies control programs can make a significant difference.